What's going on, everybody? Mike Taylor, student physical therapist. Today I'm going to be talking to you about knee pain and what you can do if you have knee pain or some limitations in your range of motion. And so what I'm going to show you are two exercises that I commonly prescribe to help accent or to help make better the manual therapy techniques that I use very frequently. So one thing to note with knee pain and range of motion issues is that in many cases, it's really just as simple as stretching your quad, stretching your hamstring, stretching your calves out. It really is. But in other cases, there can be stuff to do with the actual way the joint moves, because there's these things called arthrokinematics, and that refers to the way that joint surfaces kind of move past each other. And so in your knee, you obviously have your tibia and your femur, and those are the two primary joint surfaces that are moving in addition to your patella. So let's say you have issues getting into deep flexion. Here's one exercise that you can do that kind of helps to accent the manual therapy technique that I would be doing. And all you need is a rolled up towel. So what you'll do, lay down on your back. You're gonna put this towel roll, and you can gauge the thickness based on how much range of motion you have. So if you can't get past there, you can just kind of put it deeper up there. If you got more, you can put it further down. So for me, I don't have any issues. I'll put it right about there. And what you'll do is you can wrap around your shin there, and you're just gonna kind of pull forward like this. Kind of just doing little gentle oscillations. Do it for about 30 seconds at a time. And what I'm doing is I'm pushing the tibia kind of forward like that on the femur, which is how it goes when you're flexing the knee. So if you have an issue with your actual joint mobility, this is going to be a good exercise for helping to get that going. Good. And so one thing I want to point out is that when you're doing these, you always want to make sure you have a test and retest. So you've identified that you have knee pain, so rate your pain. Also, find a movement that actually provokes your pain or you note limitations in. So if you get to a squat and you find that you're right about like 90 degrees, it hurts, take note of that. And then you want to retest it. If things feel like they're getting better, then you can be reasonably sure that this is a helpful exercise for you and you should do more of it to help clear up symptoms further until you are at a point that you're satisfied. Talked about knee flexion. How about extension? If you're having issues getting that knee totally extended, what you can do is a exercise that looks like this. So you'll kind of bend over a surface. In this case, it's my physical therapy table. You're gonna put one leg in front. In this case, you're gonna be working on my right leg here. The right leg's gonna be behind. And what you're gonna do is you're gonna work on pushing your weight through your heel and backing it up like that. Get to that in-range extension. From another angle, it'll look like this. With my other leg. So I don't have any joint mobility issues, so this is not doing really anything for me. But if you're having issues achieving that terminal knee extension, like it stopped right there, it can be helpful to kind of bust through that. Get that knee moving a little bit better. And as I said with the other video, be sure that you are doing a test retest so you know that what you're doing is actually helping you out. As always, thank you for watching and happy training.